everybody. It is Sunshine. Welcome to our health segment. And I have got Dr. Robert Karras here of Karras Healthcare. How are you doing today?
Good, good. Thanks for having me on.
This is so exciting. Wendy threw me a loop today and was like, hey, can you take care of this interview for me? And I was like, it would be my pleasure. Most definitely.
Good,
As
good.
I get to, I already know all about you from doing the commercials and stuff with the X. Uh, I just
Nice.
watched the interview that you had with Wendy previously.
Okay.
And
hmm hmm
so that was great. That was fantastic. And so we're in a little different place than we were during that time. We were still at the like, maybe there'll only be 60,000 deaths. So from where you're
hmm
sitting, where are we now?
Well, unfortunately, here in Arkansas, the numbers have picked up the last week or two, and more cases in the community than we've had before. But we're also testing more, so that'll bring them up a little bit. But here locally, even within our clinics, we've had I think over 10 this week that have tested positive. So it seems to be hitting our area a little bit right now this week, and we'll see how the next over the weekend goes and how next week goes. Fortunately, everybody we've tested has been positive, has done well, and we haven't had anybody that's had to go in the hospital. So
That's,
that's good. But
yes.
yeah, it is concerning that our numbers are peaking a little bit right now, or turning up.
Do you feel like that is a result of possibly of us opening things up again here in the state of Arkansas?
I don't. So I just think it's not scientific, but I think the virus, to me, the virus does what it's going to do, and right now it just seems to be hitting our area. We were fortunate didn't have many cases, but now there's a few more, and I think it would have came whether we opened up or not. The places where we know it's at are high risk places, anyways, like prisons and like big areas where there's lots of people working inside spaces that don't get a lot of fresh air.
Yes.
So I think it's just right now it's our time to get some cases, and hopefully we'll. Fortunately, Arkansas. Here's a good example. We've had I think over 51 of the nursing homes have had cases in them. And if you look, the nursing homes are where the highest risk for death really is. And the first case that came into Washington County, not Washington County, Arkansas, but Washington County, King County in the state of Washington. The first nursing home had like 38 deaths there. So to me, it's unbelievable and remarkable that we haven't had 5 or 10 deaths in every single nursing home that has been infected here in Arkansas. That would put us over the 500 mark.
Yes.
And so that's a good thing. For whatever reasons, it doesn't seem to be as fatal in our nursing homes as it has elsewhere so far.
Well, it means they are definitely doing good work and doing all the protocol that's necessary to keep everybody safe.
Mm-hmm.
Yeah,
Yeah, that's good.
that's the good stuff for sure.
Mm-hmm.
So something that Wendy's curious about. So the cloth masks. And now you discussed this a little bit in the original interview that she did with you, but as
Mm-hmm.
time has
Mm-hmm.
passed and as we're opening up, it seems that there's a lot of fight over whether to wear masks, not to wear masks, where, when, um, what, which is what it is. So, what
Yeah.
is your take on wearing masks?
Well, it's interesting. Like 2 nights ago, I was up for an hour and a half, about 3 in the morning, reading this Facebook site for medical providers, and it was this long article on mask and not to mask. And 3 of my providers that I work with here in the office had said, "Hey, Rob Karras, you need to read this one." And so I read it, but it's kind of like, I think Dr. Fauci, our head expert guy from the CDC, in the 1st of March, he explained it, I thought, pretty well, that if it's not an N95 mask, it really doesn't protect you. And that's what he said the 1st of March. So, but then we have switched course from that. And I don't really see any new evidence or really good medical evidence that wearing a plain mask works to decrease your rate of infection. That said, there's a lot to be said about the placebo effect, right? And I can give you a sugar pill and tell you that it's going to make you feel better and have better energy. And 25 to 30% of the time that will do that. So if people have a lot of faith in a mask protecting them, then they're going to get a good bump from the placebo effect as well. And I don't want to be the one telling them not to wear a mask.
Yeah.
I've been pretty much a believer from the start that it's not an N95, it's not protecting you, and that's why I'd make sure. And we've had debates back and forth with our office members, our other providers, the nurse practitioners and physician assistant, and whether or not we want our patients to bring masks in with them or wear masks. And I just said, personally, I think from the evidence, let's let all our employees know that the N95 mask is the mask that's going to protect you in the studies that shows that it's effective for protecting you. So let's not get lax and think that this mask here is going to protect you.
Right.
And whether other people have masks on, I said actually I would do what my other providers wanted to do, and they wanted our patients to wear masks, but we haven't implemented that 100%. But most of our patients that are coming through the doors have masks on. So it's kind of complicated, but like if you really look at the literature prior to 2020, it goes back and forth. The one article I know on the one lady that out of Australia that does a lot of mask research, she did a big study in Vietnam, and it showed it was the normal surgical mask versus cloth mask to see if they were as effective as preventing infection. And the people in the hospitals wearing the washable cloth mask ended up getting more respiratory infections. I don't know if that's because they're breathing more germs or if they're increasing their viral load because their viral load can't escape what they're breathing and things like that. So that test, that's you can find that pretty easy if you look it up. And it's only from maybe 8 years ago or something. Shows
Do you think
you
that
an increased risk.
Do you think that by wearing a mask, I think is talking about sort of the placebo effect and things that you might do differently if you have a mask on, like you're probably less likely to touch your face. Also, does it while it may not prevent you from getting the virus as much, if you have on a mask, are you preventing other people from being as exposed to your germs?
That really hasn't been proven out in the medical literature. You still have some of the particles escaping unless it's an N95. And I think you touch your face from experience. I think you touch your face a lot more when you're putting the mask on and taking them off. My nose runs more. I'm touching my nose more and things like that. I mean, It doesn't take, you don't have to wear a mask very long to realize
those. Yeah. I do.
I touch my face all the time now.
I've realized how much I touch my face now, for sure.
I know.
All the time.
So so that's why I think it's important to really look at the literature, the scientific literature that's been out there, and just not just anecdotal studies or incidental studies or retrograde studies. You know what I mean? Because what if putting a mask on increases your risk? What if we find out in 2 years it increases your risk for respiratory infection, or it increases your risk of serious COVID infection? So we all have these theories, and that's the power of science, the double-blinded study, right? So it's like but I don't fault anybody. I don't hold it against them, or I don't make fun of people for wearing a mask.
It's interesting. I think that something that came to me at one point was, and I've said this to quite a few people, that it's the practice of medicine, right? So it's not perfect. We're still trying to figure it out. Some other things that we were curious about, you had talked about boosting your immune system, sort of trying to take care of yourself that way. You'd spoken about some supplements or something like zinc and vitamin C are very good. What do you recommend that we do?
So I think I probably recommended that the first time I was with you guys, and then I've added in the last couple of weeks recommended the vitamin D, 5,000 units twice a day, vitamin C 1,000 milligrams, twice a day, and then zinc 50 milligrams or so twice a day. So just all of them twice a day for right now. Those are all helpful for your immune system. A recent study in the last couple of weeks had showed that a lot of the patients that are ill in the hospital with COVID have low vitamin D levels, which isn't surprising. That's the same thing with the flu. A lot of times the people in the hospital with and the flu have very low vitamin D levels. And almost everybody we check all the time anyways has vitamin D levels that are below normal. It's because we stay indoors too much and we don't get enough sunshine. Because when you're out in the sun, your body will naturally make vitamin D. And some people, some of the theories for disease and why viruses peak in the wintertime is because our vitamin D levels go down.
Oh, yeah. Well,
Yeah.
you think me being Sunshine as my name, that maybe I wouldn't need any extra vitamin D, but I've also taken vitamin D for just, it also like helps you, like my mood, so it elevates everything, makes
Right.
you feel good, which also just going outside does.
Yeah, like the studies show, if you have low levels of vitamin D, you're more likely to be depressed as well. Also,
Yes.
you need it for your bone growth and stuff. So it plays a big role in your health. And so, I'm always an advocate of, and I used to give out a lot of vitamin D for people with the flu, but then a lot of the studies have shown like like for depression or for bone density, that the vitamin D supplements don't seem to work well. And I don't know why, and so that's why I dropped off using it. But it maybe is because your body's natural making of the vitamin D is a superior source of vitamin D,
Right.
than taking a pill.
Yeah. I'm not sure if it's vitamin D that's the one, but like a lot of those vitamins that you take orally, you need to take them with a fat or something, or else they don't absorb as well. I'm obviously not a doctor, but that's just some research that I've heard about.
I generally just take mine with breakfast and then after dinner or sometimes at night. They're both and the thing is with all those vitamins there, you could probably get, 3 months worth for 10 or for $20, so they're affordable and they're not that harsh on you. So if you take them without food, you don't usually notice it. I've taken plenty of vitamin C on an empty stomach and haven't noticed it. The vitamin D never seems to affect me. Zinc does tend to, if I take enough of it, upset my stomach a little bit.
Right.
But I think that's normal.
So also Wendy had mentioned something about so the stress of all of this, we might start to get into our like comfort foods and carbs and sugar and stuff like that. And so it's probably a bad idea when you're fighting off a virus or trying to keep yourself from being susceptible to it.
Correct. And I think more important than the foods is probably the stress, right?
Yeah.
I think stress is really hard on the body. You see it all the time with any, Mondays are the biggest days for heart attacks when people don't want to get up and go to work because they don't like their job. And so they have a heart attack, right? Stress does all that physical stuff and it inhibits your immune system. So that's why I like a lot of the fear mongering or despair salesmen that are out there. It really irritates me because I really do think that's bad for people's health and negatively affects their health. So that's why I've been trying to be positive the whole time. And that's why I've taken the time to do, I blog or not blog, but add to our post stuff on our Facebook site 3-4 times a week.
Right. I think that it's more important now than ever to keep people's spirits high. I think that's for sure. So that's one way of people like trying to reduce stress, being positive that way. Is there any other suggestions that you have for keeping the stress away?
Sleep. You got to make sure you get enough sleep. Don't be up late on your phones or on the screen. Get enough sleep, get outdoors. Like that's my outdoors, sleep and exercise. I mean, and try to eat healthy, real foods that you have to prepare that aren't pre-mixed or pre-packaged or fast food. So that's all real simple basics, right? It's not, I can't make money selling you that stuff, So yeah, it's basics and simple and we know that.
Right. I think it's interesting you said, trying to stay positive and stay outside and all the things that you suggested, none of them were staying inside and watching the news, which is always stressful. So I've kept away from that.
When I'm searching articles, like I'm reviewing stuff and looking at death and rates and numbers and stuff, like I've started a pattern when I Google search it. I don't look at the first page even. I go to page 7, and that's where I start looking for things.
Yes. Yes.
Big news stories are all just like, oh my gosh, you guys are killing me.
Oh,
You
for
know,
sure.
fear and despair everywhere. So
Yeah. Well, we appreciate you so much for coming on and always keeping a positive attitude. And thank you so much. It was nice to finally get to meet you, even in
thanks.
this way.
Meet you, sunshine.
Yes.
Good. Well, good. Thanks, and have a good weekend. It's supposed to be nice out.
We should all just get outside and play and take care of ourselves. Yeah.
Yeah, get in the
All right.
dirt or go swimming or kayaking or hiking or biking.
Awesome. All right. All right. I'm going to start my plans now. Thank you so
Thanks,
much.
sunshine.
You're welcome. Have a good one.